I'm Dr. Bill Adams, and this is No Spin Live, where you learn about hot topics in plastic surgery and get the real story from the world's top plastic surgeons. Not a day goes by that we don't get an email or a comment from a listener or a viewer that wants to know what's the difference between a facelift and a mini facelift or some other type of facelift, lunchtime facelift. So we need to sort this out for the viewers. So Jason, start us off.
You know what? I read the article and I actually know the doctor who wrote this article, facial plastic surgeon up the street from us. So, trying to compare a facelift versus a mini facelift, I think these are all variations on a theme. It's basically the same surgery with similar incisions. And I kind of look at it as if they need a lot of work, it's a facelift or a neck lift or a rididectomy or a cervical facial rididectomy. If they need a little less work, I call it a mini and I charge them a little less.
I think it's really confusing for patients, especially when they hear, lifestyle lift or lunchtime lift. I try to break it down similarly to how much work they would need as an individual. And instead of saying mini or full, I'll often say short scar versus longer scar. If somebody has a lot of excess skin that needs to be displaced elsewhere, then, they're going to get a longer scar up behind the neck. If there's not a lot of extra tissue for me to have to work with, then it's a shorter scar. But I try to make it clear that I'm still dealing with the underlying tissues and SMAS and lifting and repositioning of tissue other than just skin, either way.
I think the three components to facelift. One is the amount of surgery you need to do to get the result. Two is the price. And three is what you tell the patient it's called. And that's a fluid dynamic. So if the patient is sensitized to mini facelift, you still may end up doing a lot of surgery that we wouldn't consider a mini facelift, but if you want to do that case, you're going to call it a mini facelift. But I try to be fluid with the patient and let the patient talk first, because if you let the patient talk enough, they'll tell you what they want.
There's probably a place for a more minimally invasive facelift for some patients, and then other patients obviously need maybe a bigger procedure to get the result they need. So how do you explain it to people?
I think it's about managing expectations and then trying to find out exactly what bothers a patient and addressing that in particular. Some people might just want a little bit of tightening along the jawline. Some people want their neck tighter. They want more volume in their face. It's a multifaceted approach to facial aging, and it really depends on what the patient is looking for in terms of their own individual goals.
You're not going to see any of these type of insights anywhere but No Spin Live, and those are some great ones from you guys today, so thank you. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.